Uses for abstract electronic data. The motivation behind abstracting is to make data from the patient record accessible for internal and external reporting needs. Abstracting is the process for extracting data from a source document. This process supports the auxiliary utilization of patient information for registries, research, patient outcome, public reporting, and other various purposes. The hybrid record is a health record that includes both paper and electronic formats. Hybrid record can include electronic and paper record, images, audio, film, and microfiche. Transforming to a completely electronic environment is a very difficult process for healthcare organization because health information acquired in the years prior to the EHR implementation are in various formats. Therefore, a hybrid health record could exist for years to come. Knowing the what, the when, and where about the health information maintained by a healthcare organization is integral in a health hybrid environment. EHRs are stored digitally in a clinical data repository or data warehouse. A data repository is used to gather data, but it is not designed to perform high-level data analytics. A data repository is a database that holds data, but a data warehouse has the ability to pull data from different sources. They are designed to receive a large amount of data and perform analytics processes on the data. Health record storage systems and EHR systems have a much more to offer beyond the paper-based store system used to house large amount of paper medical records. This process can become costly over time. So an electronic document managing system is another alternative that can help reduce this cost in some way because it involves scanning medical documents to create a digital image that can be integrated into the EHR and is made available in real time. The EHR has many benefits. We discussed some earlier, but that continues to be acknowledged by the healthcare industry. One benefit is the streamlining of the process to complete a task, a job, or a responsibility, and this is known as a workflow. Health information functions that used to take more time and manpower now take less time and fewer people to complete. For example, completing a request for a release of information could take up to 5 to 7 days to process depending on the workload. But due to the functionality of an EHR, these processes could be done in 2 to 3 days depending on the number of requests received. Functionality refers to what the system is capable of doing and how it is done by the system. So another example is the amount of time it used to take to gather paper medical records that were sent throughout the hospital during a patient care. The use of the EHR has eliminated this task completely, even if components of the medical record is hybrid. The information can be integrated into the EHR and made available for patient care. Electronic health record entities are authenticated using electronic signatures, digital signatures, biometric verification, public key certification. So let's talk about each one of these. The electronic signatures are an electronic version of a handwritten signature. A digital signature is a number generated from an algorithm. The number is attached to the document, verifying what the originator intended to present. Biometric verification are based um, on you needing identification characteristic of an individual. So that's such as a fingerprint or a biological trait, hand geometry, or characteristics. So they also use like the retina or iris pattern. They also use voice waves. So these are all examples of a biometric verification. Public key certification is a certificate which is used to verify the information was sent from a particular user or source. So sending documents between physician practice using a public key certificate to ensure that the information comes from a specific sender would be a private key. Guidelines to prevent fraud and ensure EHR documentation integrity. The most common types of healthcare fraud include billing of services that were not provided using actual patient information, upbilling or upcoding by billing for more expensive services that were provided when effective lower services were available, providing a necessary service to a patient to increase insurance payments, falsifying a patient's diagnosis to justify needless services, bundling codes when an individual code is available for billing, also billing a patient beyond the required copay for services that were covered by the insurance health plan. So these are all examples of fraud in the EHR. There's also medical identity theft. This is occurring more frequently as healthcare organizations become more technology oriented. Identity thieves are stealing medical coverage data, such as the social security numbers and other personal information to scam people and to sell to other hackers in the United States and in other countries. Authorship integrity. So this is the maintenance and monitoring of authorship integrity in the EHR. The EHR is responsible. The EHR is the responsibility of the organization and the employees with the right to use the system. So authorship integrity involves allowing more than one clinician to add documentation while covering the authorship of another clinician. Then there's auditing integrity. So an audit trail is a chronological record of all accesses and changes to data record, often used to promote accountability for use of and access to medical data. The record is an audit trail, show how and what data was accessed, when and by who, and from where, and if possible, some indications of the reason for the access. So there needs to be a need to know, right? Auto-population in the EHR. Information integrity issues can arise when invalid auto-population of a data fields and pre-designed documentation responses are geared toward enhanced reimbursement. Corrections in the EHR. This is when a correction is a change in the information that's meant to clarify inaccuracies after the original electronic document has been signed and rendered complete. Corrections may also involve removing information from one record and posting it to another within the electronic document management system. So there are policies and procedures that must clearly address the process to correct errors. If not, this can result in legal implications. So for example, if a name, diagnosis, or word used to document a procedure completed during the course of treatment is not corrected properly, according to the policy and procedure procedures on correcting errors, then this could be seen as not being corrected, and the hospital or the physician could be held liable. Health information exchange allows healthcare providers to access and share health information. Unfortunately, there are still some barriers, and we talked about barriers earlier, to the practice of sharing health information, particularly because the EHR purchase is purchased by different vendors. And these vendors, because they're purchased by different vendors, they cannot communicate, meaning interop with each other. This inability to communicate is because there is a lack of transfer standards for exchanging patient data entries, also known as data interchange. For example, so a patient who receives services at an urgent care clinic over the weekend has presented to their PCP office for a follow-up. This person informs the front office staff of this encounter at one of the urgent clinic centers, and they called the urgent care center. The front desk clerk calls the urgent care center to obtain a copy of the medical record. However, neither party signed up for information exchange that was made available through the local teaching hospital. The patient now has to complete a request for release of information. So they need the signature, has to be verified. There's a lot of processes that has to take place. And then the record has to be sent over via fax. Just think about the time that went into this process. This example is a clear indication that timely sharing of patient information can assist providers and patient to help them to make more informed decision about the healthcare treatment options. So this person now has to wait to get the appropriate care at the right time due to these hospitals not having this signing up for the information exchange program. So this ends this part of our session.